So from your perspective, how does chronic stress and nervous system dysregulation contribute to the experience of ongoing pain?
Yeah, I mean, I think if you think about it like a vibrational frequency, which sounds a little bit crazy, but it isn't. We're vibrational beings and we're electrical beings. And when you have this stress, it creates a lot of constriction and a lot of tightness in your system. And then you create these looping patterns of questioning and doubt and fear and concern, which is very normal and very human. But then that creates more constriction and more stress on your body. And then you start contracting and contracting and contracting. And that then creates this tightness. And we think about ourselves like, think about when you are really tight and you really want a great massage or something like that, and how much that tightness really affects all other areas. It could affect the way you breathe because you're so tight chested. It could affect the way you digest because you don't have any room to expand in your digestive tract. It can affect so many different ways that we think about physiologically, but it also affects us emotionally, spiritually, mentally. It affects all parts of our lives.
So uh, how does that contribute to the experience of ongoing pain?
I think that it amplifies it.
Mm.
It amplifies, and especially because we become very hypervigilant. This is definitely my experience as well. With MS, I was very hypervigilant about everything that would contribute to my symptoms and created a life that was very vigilant about avoidance and control in my environment, avoidance of all of these things. And then there was some fear, like if there was an accidental thing that I ate, or there was like a place that I was going where I wasn't really sure of the quality or the ingredients in any food, like a potluck or something like that. And so then between the fear and the hypervigilance and the control, then that just amplified all of my symptoms. I was like so vigilant for every symptom to appear. And of course they did. And then that just would spiral me into another place of overthinking and overanalyzing and creating more fear and more hypervigilance.
Yeah, I mean the guys I mentioned, Lorimer Moseley and David Butler, that they often say that pain is a danger warning system. It's the way that your internal system is aware of danger on the outside. So what you're saying is the more stressed you are, the more vigilant you are, the more you're looking for danger, the more that nervous system is heightened, and therefore the more likely, because your nervous system's overloaded, the more likely you're going to feel pain. Would that be correct?
Yeah, that's absolutely correct. But I do agree with those two authors, and I apologize, I'm not familiar with that book, but it does make so much sense. And it is maybe the underlying thing that your body is talking to you. And this is part of working with your nervous system is a new way of learning to relate to your body and listen to what it's actually trying to tell you. And so in this circumstance where, you have this pain, and it is your body's way of telling you that something is wrong and something is amiss. And then we create all these stories, mental stories, and then all of these behaviors like hypervigilance. And then from hypervigilance, then you create all of these decisions and these stories about yourself and about your needs. That just compacts
Hmm.
the original pain and the original signals from your body that they're trying to tell you. Does that make sense? And you're just
Hmm.
compounding the issue.
If this sparks something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify, or listen on Apple Podcasts. Like, subscribe, and stay connected for more.